Hey, awesome YouTubers. Martin here. So today, I'm going to drop some content on Medical Mondays. So kind of as a continuation of those of you who have been thinking about med school, that kind of thing. Talk about my journey in medicine. I think that's the first half of this video. And then how I would compare medical school with anything else that I've done. So, are you excited? Because I'm a little bit excited and I'm trying to think about how this whole process was for me. And I'm excited to share it with you. Hopefully you find it informative, if not mildly entertaining, because you'll be like, wow, what is this guy doing? What has he done? Kind of thing. By the way, as an LGBTQIA+ person, I wanted to show my little swag here. Jesus said, oh my God. I said I hated figs, not the other way. So those of you who are pseudo-religious or whatever the term is, you might have found that humorous. So shout out to my brother-in-law, BB Gregory. William Gregory gave me the shirt. Hashtag William Gregory. So going into my medical school training, I think my last video, if you want to look at that, feel free to hit that subscribe button and you can see my video library. So my med school, I talked a little bit about the undergrad stuff that I did. But once I got into medical school, so those of you who aren't aware, the first 2 years of medical school is called the Basic Sciences. And then the last 2 years of medical school, this is in a traditional curriculum, the last 2 years would be your clinical application. So you would actually be applying those things that you learned in the first 2 years of your medical education in a clinical setting, like a hospital or clinics, something clinical. Although in the first 2 years, you will also learn a lot of lab and lab-related simulations that would prepare you for your clinical years. Okay, but your first 2 years is really mainly focused on learning, all those essential things like anatomy, biochemistry, physiology, embryology, genetics, immunology, microbiology. Okay? I have my little bit of a cheat sheet here so I can give you a good, solid stuff there. So really you have to go through anatomy, behavioral sciences, biochem, embryology, histology, fun, microbiology, neuropathology, pharmacology, and physiology. So those are the ologies that you'll be studying in your first 2 years of medical education. And then the last 2 years, you'll be going into the different specialty rotations. You'll be doing internal med, psychiatry, surgery. You'll do all of those different specialties, and you get to practice the things that you've learned in the first 2 years of your medical school and apply it to real patient scenarios. So it's really fun and fascinating to be doing all of that. If you want to learn a lot more about how to get into med school, drop me some messages here in the content and I'll talk to you about things that you can do, things that you want to look at, the myths, the pitfalls that prospective medical students do get into as they're doing their search. All right, so back to those first 2 years. It's really, really intensive. The sciences are very, very strong. The content and the material is really, really heavy. To give you a perspective, so I have a lot of sciences in my undergrad, and then I have social and behavioral sciences in my grad school education. The level in which you're learning this would be very similar to your upper division if you were doing, say, a bachelor's in biochemistry. It's really, really intense. Plus, you are tested. The school that I went to, at least, tested me as if I was getting ready to take the step 1, which was one of the strengths of the school that I went to, IUHS. And in fact, I think I've shared with you that many of my professors, about maybe 60% of my professors actually are Kaplan board review professors. They're like those PhD folks that have written the review books for Kaplan Medical. I don't want to drop their names, but DM me, PM me in my social media stuff. Drop me a comment. I'll be more than happy to give you some of my social media accounts, and we can talk about those people. They're brilliant. They really dig deep. They break down the material really well, and then they'll give you the high yield information. So, giving you the content as far as the first 2 years, to give you a perspective, I did a year and a half or a year and a quarter of medical school before I decided, nope, I'm going in a different direction. So now I'm pursuing my nurse practitioner credential based on just life stuff, what makes best sense for my situation. I had to step back and look at a whole bunch of factors that affect my life and the next 8 years if I was in medical school versus the next 4 years, 5 years maybe, if I were to go in the NP route. So that was my thing. Again, if you have comments about that, you can drop it down there, like, dislike, subscribe. But the content was really intense, I know I've said that, but was also very fascinating. I have always liked the sciences, very curious about it. I have to say I wasn't really great at it. In my first undergrad, I was like, whatevs. I was one of those bio majors that was not decided fully. But once I got into it, I think nursing school was when I was really more fascinated, because I've never been this smarty pant academic nerd person. You could ask anybody who knew me as a child. I wasn't that person. Those of you who know me on social media, by the way, from my high school, you probably would never have guessed Martin Ponciano going to medical school. No. Or even in medicine, I was kind of the theater arts person. Nevertheless, here I am, healthcare, 20 years in healthcare, science major, graduate behavioral sciences degree. It's just really fascinating. I really fell in love with it. And I was very rarely satisfied with the what. I'm always curious about the why. I didn't always have an answer to the why, but I was always curious about the why. And I think that's an attitude that you have to bring into medical school. In retrospect, I'm going to go into the comparison. What I'm studying now in nursing, it's a different focus. We study things that are very similar. My undergrad is clinical lab sciences. How we approach clinical microbiology is different from how we approach medical microbiology. As a CLS, my focus was preparing those slides, reading those slides, analyzing those tissue samples, also being familiar with the gadgets, the flow cytometry, all the things that we use in a laboratory setting, right? That was my focus. In medical school, you have to learn histology, so you have to learn the slides. What tissue sample are you looking at? And what's wrong with it, right? What is normal histology and what is histopathology? Like, oh, okay. That cell looks like it has the owls for cytomegalovirus. Woot woot. In clinical lab science, yeah, we get that, we know that. But in medical school, you know that. Now what are you going to do? You, the physician, what are you going to do next? It's not just, it's one thing to know, yeah, cytomegalovirus. Well, what are you going to do? Supportive treatment, antiviral therapy, that is your decision. And in nursing school, I felt like we've done quite a bit of science too. But the focus of the sciences in nursing school is not even close to the gravity and the detail that they put into medical school. So those of you who are nurses or are in nursing school, you might be jamming. You're like, awesome, yes, you get it. Boop, boop, boop. Then you go to med school, if this is your path. You're like, dang, you get to answer a lot of the whys. Because in nursing school, they don't really answer all of the whys. Why are you doing that? Not that you don't know why you're doing it, you do know. They give you a rationale. So for example, why are you giving aspirin? It's an antiplatelet. We know that. It thins your blood. By the way, it also has some anti-inflammatory properties. Cool. You'll learn that as a nurse, and maybe you'll get a little bit more depending on your professor, right? Depending on who's teaching you. But you don't get into it like what is aspirin and how does it work? Well, in med school, you'll get the cell, you get the G-coupled protein receptor right here, right? And then you're gonna get something, an inflammatory protein, which is a prostaglandin. When your body's damaged, whatever caused the damage, right? It could be an injury, could be trauma, could be an infection. So your tissue gets damaged. It's gonna release these chemicals, these what we call tissue hormones called prostaglandins. Prostaglandins will go into the surface of your cell, and it has an attachment on your cell, and that will activate what's called the G-coupled protein receptor. G-protein coupled receptor. Whoop, whoop, little rusty. So that's the level of medical school. You get that G-coupled G protein coupled receptor. It will activate it, and then it will activate a whole chain of events within the cell. And in the inflammatory world, you have arachidonic acid. And arachidonic acid is then going to do, it hits two pathways, the LOX and the COX. No, not that dirty one. It's LOX and COX, lipooxygenase and cyclooxygenase. Okay? Cyclooxygenase over here is that piece, COX-1 and COX-2, right? COX-1 and COX-2 works on two different variables of the body. So GI tract, platelet aggregation, all of those things, right? So you get into those levels in medical school. So you understand, where does aspirin work? Right here, not on lipooxygenase, not on the arachidonic acid up here, not quite up here, but it has anti-inflammatory. That's because it works with COX-1 and COX-2 over here. Plus, right, you'll also learn like what works up here in the higher level of the hierarchy. You've got steroids, right? Steroids that will actually block this whole inflammatory cascade. So it's at a higher level. So you learn all of these fascinating, wonderful things in medical school. Amazing. And in nursing school, very chill, very, I wouldn't say really not intense, but it's not as intense. We are heavy on the skills in nursing school. So I think that's one of the biggest things, bigger things. And now that I'm back in nursing school, it's quite funny because I have to dilute my brain because I have all of this like biochemistry, pathophysiology, physio mindset of what I learned in medical school and what I need to do if I have a patient like this, and what are the genetic predispositions, and I gotta look at like, go to purines and pyrimidines and the 21 amino acids and the metabolic pathways and the diseases that occur when the metabolic pathways fail, right? And the symptoms and what I need to do and how I need to treat it. That's all different in nursing school. In nursing school, it's like we look at the signs and symptoms. It's very clinical because we are aware of the signs and symptoms, but we don't get into the why on a biochemical, on the microscopic, molecular level. So I think that's one of the biggest difference that I'm noticing in nursing school, and I have to really turn down the moleculometer. Yes, that's a new word. I had to turn down the moleculometer in my head because I'm thinking on a microscopic, on a molecular level, why these symptoms are occurring. In nursing school, you don't get that deep. And in fact, I've gotten a couple of those comments from my professors. That's too deep. I got that in pharmacology today from one of my instructors. That's too deep, Martin. That's for when you go to NP school. And I get that, but my brain is just that way. So if you're that kind of person that you really like the microscopic molecular level, nursing school is fine. You'll learn a ton of stuff in nursing school. You learn a bunch of skills in nursing school as well. So many skills. You'll learn a lot of that in medical school as well. But it's just a lot more intensive in medical school versus nursing school. So I hope this helps give you a perspective as to what you will learn in medical school, what you have learned in undergrad and how it's different. If you have any questions, any comments, you're like, Martin, you totally got that wrong. I probably did. I might have. But I would love to hear your comments, your likes. Again, if you're gonna do a dislike, feel free to comment and say, dude, you got that totally wrong. I went to nursing school and I have a bomb professor that broke it down on a molecular level. We went and looked at the nuclear envelope, and we went inside the coils and the rungs of the DNA and the histones, and we uncoiled the histones. If you were that kind of nursing student, wow. Anyway, yeah, love to hear from you. And keep an eye out for more content on medical training on this Medical Monday. I will see you on the next one, people. Take it easy.